some amazing narratives of the difference that they're making to the population that we serve here in East London. It's incredibly diverse and vibrant, and there are real opportunities to improve children's health outcomes.
There's no question that many of my medical colleagues who had no experience of undertaking clinical research projects have been able to take this on solely because of the team here and the nurses and data managers who actually do most of the work involved in the studies.
So what the research team have done over the last few years is really integrated clinical research into the trust. It's made us a hospital where we can perform cutting-edge research. They've brought in the voice of children as well as linking researchers together and allowing us to create new research and generate new knowledge.
In the last 2 years, it's amazing to see how much they have achieved and how much they have grown in the sense of the amount of clinical trials they have taken on. I have set up studies that have reached from phase 1 to phase 4, first in humankind, even Barts Health achieving some first global recruits.
We're very, very fortunate that we have one of the senior research nurses from the Barts team as our paediatric champion for North Thames, and through that we're able to reach out to so many children across the network. So well done for a fantastic job. You've built up a unit which has been absolutely phenomenal.
It was just inspiring to work with this team. They were so passionate about research and the power it has to improve patients' lives, but at the same time just really focusing on the needs and the best interests of the children and the families that they were working with. And it's really what made me interested in becoming a research nurse.
They work to make sure that research is delivered both effectively and to the highest standard for the benefit of the children that they serve, but also make it an enjoyable experience both for the families and for the clinicians as well. And I make no hesitation in recommending them for this award.
I've had a huge amount of support as I've prepared a application for a pilot scheme with the MRCP and NIHR. I'm going to be studying a multi-systemic disease incorporating several different forms of endocrinopathy. The nurses were integral in helping me prepare my application, and I was thrilled last week to hear that I've been successful.
What they're also doing is transforming the culture and making sure that we're all aware of the importance of research and how we can get more children, young people and their families involved in trials to improve health outcomes right across the country and beyond globally.
Feedback I've had from the people running some of these trials, the sponsors and industry, is always positive as well. They really feel that the team know what they're doing, are experts and are supportive of both the companies organising it as well as the patients. Similarly, patients are always happy to participate and get a lot of support, even though at the beginning they're very nervous about being involved in research. All the patients I've had in the studies have come away with very positive experiences of it, even when the drugs haven't worked for them.
You don't feel as though it's hard to do, or when you think about coming here, you don't think of it as a chore, you think of it as something that you like to do.
I would definitely recommend this to community, to the family, to the young kids as well, because this really worked for my family, for my children, especially for Kismet. For 3 years, it really worked for her. And for Mackenzie, at the moment, I can see these changes because she's not feeling tired anymore, and then she doesn't have temperature like that anymore. So I really recommend this to everybody, to the family, community. Just give it a go. Try it. It's a try. So just try it for some time. It doesn't work for you, you can always stop. So I would definitely recommend this. Thank you very much.
I used to always look forward to coming here because all the people here were really nice, and I knew it wasn't like a scary visit to the hospital. It was something really nice, and my opinion was like really included in it. So I wasn't just listening to all the adults talk. They asked me how I felt about things, and they really included me in it, and I just felt very welcome.
I'm Taylor, I'm 16 years old, and my experience with the research team has been great. They make me feel part of the team and very involved during all my research appointments. They have helped me to make decisions, very hard decisions that will help me in my day-to-day life, and have been a good support system for me and my family. It's something I would definitely recommend for people to get involved with and be part of the research team.
They have always been friendly, professional to me, and extremely supportive. I think they are a superb team.
They are approachable, extremely knowledgeable, and have really helped both the Trust and the patients we look after access really exciting research opportunities, both to understand condition and further improve care.
Yeah, they're an excellent team, they're very helpful, they push research forward, and they are an asset to the Trust.
First and foremost, they are patient-focused, they are kind, they are incessantly professional.
I would just like to wish the team the best of luck, thank them for everything that they have done for us so far, and I look forward to continue working with them in the future.
The team have actually grown from strength to strength, and it's been a privilege to work with them since 2014. We're incredibly lucky that their expertise, dedication and care reaches far beyond the children that come here to Barts Health for inclusion in research. Through the training and the expert help that the team gives the whole region, we now have nurses that have trained under their expertise working to support children in clinical trials across many of our trusts.
Do you like research?
Yes.